Monday Health Minute, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes. There's a global health threat these days, antibiotic resistance. Antibiotics are just becoming less effective because they're so used and overused. So we're talking about this today with Valley Health family practice physician Dr. Amy Marsteller and with Dr. of Pharmacy Katie McLeod. Thank you so much for being here.
Thank you for having us.
It is a great topic because this is a real concern for all of us. So let's start it off with simple. What exactly is antibiotic resistance?
Antibiotic resistance is when bacteria are becoming almost smarter and they're evolving and learning how to evade the treatments that we use for them on a regular basis.
So what does this mean for the average person if they're becoming smarter than our treatments?
Well, that's your question.
Yeah, it means that the medications are not working as well as they once did. You know, these bacteria are evolving and trying to survive just as we are, and so they're learning different mechanisms to combat the medications that we're throwing at them.
It sounds like not a big deal, but really this is a big deal. Why should the average person be concerned about this?
So this is a major public health issue. Multi-drug resistant infections cause approximately 2 million infections per year and 23,000 deaths per year in the U.S. This is important because if you or your loved one gets an infection, then you want to know that there's an antibiotic out there that treats it. So it requires everyone pulling their part, doing their part to to get this under control.
So can you guys think of an example of when this has actually happened? Like, have you had a patient or someone that you've had to go through course after course and you just can't find some way to treat them?
There are so many examples. I think the most common example people hear of on a day-to-day basis is MRSA. MRSA is a kind of staph that's become resistant to a lot of antibiotics we use, and I think most people have had their children or themselves have had an infection, but there's such a big variety. So patients that have had pneumonias, urinary tract infections, sepsis, all kinds of things.
So this is across the board. I remember it took 3 courses of an antibiotic once for me to get rid of strep throat. I just couldn't shake it. Did I play a part in that? I mean, what can we do as patients to try to address the problem?
Well, everybody plays a part in it. Antimicrobial prescribing is a big behavior that we focus on. Anywhere from 30% of antibiotic prescriptions are unnecessary altogether. Up to 50% of them are inappropriate, so maybe they're picking the wrong drug, the wrong dose, or maybe the wrong duration. And by doing what we do, we want to provide education to patients so that you can ask the appropriate questions, so that you can make sure that what you're being treated for does necessitate an antibiotic, or maybe it doesn't.
Okay, so what does and doesn't necessitate an antibiotic?
That's a hard question. I think that the thing that you can do the most is know the difference between a cold and a bacterial infection. That's probably the most common. If you have mild upper respiratory symptoms like you have a runny nose and a little sore throat and a little cough, those things are okay to wait out at home for about a week and see if you get better. If you're ever not sure, you should always go and see a doctor or a provider at Valley Health, and they can help you distinguish between what's viral and what's bacterial.
When's the red flag that you should head to the doctor there? You say wait it out for a week. Okay,
yeah.
So let's just dive a little bit deeper here. You waited out for a week, but everybody's impatient. We all want to feel better immediately. What are the signs that this is not working and it's time to go?
So I always think if you start to get better and then you're getting worse after that, or if you have a fever that lasts longer than 5 days, it's always a good thing to go in and be checked out as an adult, or any severe symptoms. If you're having trouble breathing, if you can't stay hydrated, those kind of things always make you seek care immediately.
Okay, let's talk about some myths and misconceptions about antibiotics. What are some things that you guys would like to address with the general public?
Well, I think generally people think that antibiotics are absolutely safe with no risks, and it's good to use them just in case. That's not necessarily the situation. A lot of antibiotics have serious side effects with them. You have the increased risk of C. diff or the antimicrobial resistance that we're trying to prevent. So they are life-saving medications, but it's important to know that they're not without risks as well.
And what about the future of antibiotics? Since our things are starting to run out of what works, what's ahead?
That's a hard question. I think we need a crystal ball for that one. But the biggest thing that we're seeing is antibiotics are not being developed as quickly as bacteria are developing resistance. So for the future, we're concerned that at some point we might not have antibiotics that work for our different infections.
How is Valley Health addressing antibiotic resistance?
So a lot of hospitals and clinics, including Valley Health, are forming antimicrobial stewardship programs so that we can monitor the use of antibiotics and also provide resources to our providers and our patients just to monitor the use and reduce the incidence of resistance.
Thanks so much for being here, ladies. Thanks for checking in on Monday Health Minutes.
From the